Good afternoon, I'm Walt Bauer, and I'd like to welcome you to the Human Development Institute's second fall seminar. We will be hosting an additional seminar on December 5th, and we hope you will join us for that seminar as well. Information and registration for that seminar is available on our website at hdi.uky.edu.
I'm sorry, I didn't realize that.
We have multiple sites around the state joining us this afternoon. As all the sites have previously tested connections, we don't expect any issues, but should you need assistance, contact the technical support at your site. Also, please be sure that your microphones are muted. Our presenters will provide an opportunity for questions this afternoon. We welcome all questions from all of our sites. Should you have any questions about continuing education credits, please contact me. I also want to remind everyone that you need to sign in at your location, and please take a moment at the end of the seminar to complete our brief evaluation. It is really helpful as we plan for upcoming seminars. Now I'm going to turn things over to Lindsay Mullis, one of today's speakers.
Hey. Thanks, everybody. I'm really excited and honored to be here with this panel of my friends and fellow health ambassadors. A little bit about me. I have a background in psychology and exercise science as well as health promotion with a HDI certificate in developmental disabilities. And then currently I work as a health and wellness coordinator for HDI along with the Health Matters team at University of Illinois at Chicago. So that's who I am, and these fabulous, lovely people I've got with me are my, like I said, my health ambassadors. We ran a pilot Health Matters program on campus this fall, and so we're really, really excited to talk to you all about what we did with that today. I'm going to go and let everybody introduce themselves, just tell you their name. I'm going to start over here with this handsome fella.
I'm Larry.
Okay.
Brittany, Tamara, Sue,
Monica.
Jake.
Jake, tell me your name. Say your name.
Daytona Wilson.
Hey. And we're all really excited to be here with you today. So to get started, most people know that being healthy is important and that it matters. And the thing about that is that means exercising and eating healthy. And so certain conditions that are associated with not eating a healthy nutrition or having an inactive lifestyle are things like obesity, high cholesterol and cardiovascular disease, as well as stroke, diabetes, even depression can be related to that, and just decreased productivity and independence. And the thing about all of these things is that they relate to our overall quality of life. And what's really interesting is that we can impact that. We have the power to make changes to influence these type of factors. So when it comes to obesity, in 2010 of August, the CDC released a report that said that 72 million plus adults in the United States were considered obese, which is staggering numbers. And then with that come the healthcare costs. So if you look at an individual who's obese compared to someone who's not, their average yearly medical costs are a little more than $1,400 higher than someone who's not considered overweight or obese. And back in 2008, the total cost of spending for obesity-related health issues was $147 billion, which was 10% of the total medical costs of that year, which is just staggering. And the thing is that it affects the entire country. So this next slide shows a map of the United States based on the Behavioral Risk Factor Surveillance System released by the CDC in 2013. And this is showing rates of obesity by state. So as you can see, it's not the same across the entire nation. It's definitely more prevalent throughout the South. So that comes into mind, what kind of reasons could there be for that? What kind of environmental or social factors could play a role in looking at why it's different across the state? And with that, interestingly enough, Kentucky, as you can see there in orange, is one of the higher states. They came in at 30.2% of the population being obese. So if you think about that, that's a third of our population being in the obese category. To indicate what it means to be obese, the factor that we use for that is body mass index, which is also BMI. And so that's a measure of looking at your total body fat based on your height and weight. So the chart that you can see here shows just you can look at your height, where's your weight, and where that correlates on the chart, and where the normal levels are in yellow, what would be considered overweight in orange, and obese is red. Now, this is a great way to use this for research and just to kind of have standards and numbers to look at. It's valid for both men and women, but it's not perfect. There are limitations with using the BMI for obesity, and as you can see in the picture there, both of those gentlemen are 6 foot tall and weigh the same, but have different builds. So BMI does overestimate body fat in someone with an athletic build, as well as underestimates it for individuals who are elderly or have a low muscle mass. But it still is interesting to look at those numbers. This map shows heart disease from 2010 on the same behavioral risk surveillance survey, looking at the prevalence of coronary heart disease across the nation. Again, you can see that it is more prevalent in the South, which brings to mind those same questions about what's different for that. And interestingly enough, the lowest number was 3.7 in Hawaii, and the highest number for heart disease at the 8.2 is Kentucky. So we won that one in this map. The American Heart Association released this data in 2010, and I think it's really a good visual to mention that physically inactive people are almost twice as likely to develop heart disease as active people. So that makes inactivity as serious of a risk factor as smoking, high blood pressure, or high cholesterol. And that's something that we have the power to change, how active we are, and can influence these things. This next map looks at avoidable deaths from the factors of heart disease, stroke, and hypertensive disease, which is high blood pressure, from 2008 to 2010, and it's even broken down by county. So again, we can see there's going to be the environmental social factors that show that it is more prevalent in the South. And again, that the numbers are high, that you can really not see too much light blue on that map at all. So with this, cardiovascular disease is actually the leading cause of death in the United States. And on this map, it shows the avoidable deaths, approximately 800,000 per year. And those deaths on the map are for individuals younger than 75 years old, but 56% of those are actually younger than 65. So it's incredible to think that there's that many deaths that are occurring when we can do something about it. We can change our lifestyle factors because these are potentially avoidable deaths. So hypertension, which is high blood pressure, is actually one of the leading causes of death that goes hand in hand with cardiovascular disease, and it affects approximately 30% of the United States adult population. In a study that was conducted by the National Health and Nutrition Examination Survey, also known as NHANES, they found that adults with disabilities were 13% more likely to have high blood pressure than those without disabilities. And the numbers of that are really staggering, with adults with disabilities being 34.2% and those without being 26.9%. So to look more at some of this data, the National Core Indicators, just to kind of give some back history on what that is, started in 1997 as a collaborative effort between the National Association of State Directors of Developmental Disability Services and the Human Services Research Institute. And it's a survey of the population of individuals with intellectual and developmental disability, which from this point forward in the presentation I'll just refer to as IDD. And they surveyed that population and were able to get standards and numbers that will help with performance measures so that states can know where they're lacking, ways to manage quality, to compare us across states, and also to set benchmarks to hopefully improve upon these things. To date, there are 41 states, that are participating in the National Core Indicators, which is NCI. So how does Kentucky compare to the rest of the states when it comes to wellness? For this past year, 63% of those with an IDD across the nation were considered overweight or obese. When it came to Kentucky, our numbers were higher at 68%. And then if you looked at individuals who were receiving the supports for community living, it was even higher at 70.5%, which is discouraging to think that if they're receiving those supports, they should be more supported to lead healthier, happier lifestyles, to not be as obese. I'm a visual learner, so I also wanted to include a chart to kind of show those numbers. As you can see here, the nation is in green, where Kentucky is in blue, and then the SCL individuals are in yellow. And you can see that the population we're beating out the nation when it comes to our weight. This chart shows the level of physical activity, only 30 minutes for 3 times a week, which I know my panel up here can tell you that that's not quite enough, right guys?
Right.
But that's what the National Core Indicators asked, just a low baseline, and even then we are drastically below the numbers of the rest of the nation at 14% of our folks being physically active 3 times a week for 30 minutes. So just a couple more infographics. This one from the study, I can't quite read that, Lancet study, I thought was interesting to show how we compare as a nation to the rest of the world. And that shows where 66% of the United States is obese or overweight compared to the rest of the world at only 37%. And that's for adults. And then with children, it's still just as high, with 29% of our children being obese compared to 14% of the rest of the nation. And then when you add in an intellectual disability, the obesity rates are even higher at 57%, according to the CDC, for folks with IDD. And then when it comes to the exercise, the CDC says that 50% of individuals across the nation participate in exercise that's conducive with healthy lifestyles. And a reminder again that Kentucky's coming in at 14%, which is really low. So when it comes to fruits and vegetables, as we know, which is the foundation of a healthy diet, right? Kentucky's numbers are even low there, where as a state, we have 45.9% of our population that only eat fruits once a day. And for vegetables, it's only 25.2% that eat one vegetable a day, which is really sad, right, guys?
Mm-hmm.
Yeah.
Sure.
Yeah, that's right.
That's right. So with the Health Matters training that I received to become a certified master trainer for the program that we're going to talk about later today, one of the handouts that I received I thought was really, really eye-opening, and I wanted to share those facts with you guys today. So it's looking at the myths that people might believe for folks with health perceptions for individuals that have IDD and what the truths are. So some people think that people with IDD are sick, when in all actuality, people with a disability can see themselves as healthy, just like anybody else. One of the myths is that people with disabilities are overweight or obese, when in reality, people with disabilities can have a healthy weight and lead a healthy lifestyle. Another myth is that chronic conditions are disability related, so such as obesity, diabetes, or high blood pressure. Those are a result of having a disability, and really that's not the case. Those are actually lifestyle related conditions. So leading a sedentary lifestyle, having poor nutrition, or just lack of opportunity to lead a healthy lifestyle, make those healthy choices, that's what is causing that. Another myth is that lifestyle changes are impossible for folks with IDD, when the truth is that health promotion strategies work, and they work very well. One other neat factor on that handout I wanted to share with you is that successful aging across the lifespan is only 30% genetics and 70% choices or behavior. So that means that we have 70% influence over how we age and what our health is as we continue to grow older, which is quite substantial amount. So what's the cause? So we've seen these astronomical numbers, you've seen the maps, you can see that we're not healthy as a nation, let alone a state, but that we can do something about it. So why the numbers are the way that they are. And the reason is that weight gain occurs when the calories out don't match the calories in, right? So you're eating too much and not getting enough physical activity. Obviously, there's some environmental and social factors that are playing a part. That's why the maps have the different colors and that they're higher in the south. And then you think about nutrition habits. Access to healthy meals, such as fruits and vegetables, those are limited. When it comes to restaurants or fast foods or even vending machines, the things that you are most likely to be offered are not the healthiest option. And then the cost. It's cheaper, it's more convenient to eat at those places versus cooking something healthy at home. And then those foods that are high in sugar and fat, those are what are most highly advertised and marketed. So if you go into a grocery store, the things that you see right off the bat, or even when you go to checkout that are right there at the checkout, that's all processed and not good for you. You know, the things that are on the outside of the store that start with your produce section and you go into the fresh foods areas, that's where you need to be, but they're in the back, right? They're in the outlining areas. And something else that's kind of interesting that the CDC said is that 6 out of 10 individuals in America drink a sugary soft drink or drink at least once a day. And I think at least is probably being nice, because I know a lot of us drink probably quite a few, right? So it's just everywhere. And that's the nutrition side of it. If you look at the physical activity aspect of it, transportation to parks and recreation areas can be difficult, or just the availability for walking or biking places. If your community doesn't support that, you're not going to be as likely to do those things. But the thing about it is that we all have the power to change these things. By using education and health promotion, we can promote healthy lifestyles so that we can decrease the risk of those conditions. So what are some issues with doing that? Everybody can experience barriers with healthy nutrition and exercise. Things like lack of having those healthy food options, or something like difficulty with chewing or swallowing, or maybe medications that affect your weight or appetite, physical limitations that might seemingly make it difficult, right? Like you might need a walker or a cane, and that might deter you from being physically active, or being in pain. Lack of energy, I think, is probably everybody's number one excuse, right, for not engaging in healthy lifestyles, is that you don't feel like it, whether that be going home and cooking a healthy meal or actually walking around the block. That's usually the number one excuse, right? And then the accessibility to resources and just overall lack of them, like time. Who has the time to do that? The money, whether it's transportation, you might not have the social support, or even just the knowledge to know what it takes to be healthy. That can be a big barrier for everybody. So health promotion can help with that. Research has demonstrated that by focusing on healthy diet and exercise, it can improve the quality of life, both physically and emotionally. So this can decrease the risk of those conditions that I mentioned earlier, as well as losing weight and, ironically, having more energy, right? So even though you feel like you don't have energy, by actually exercising and eating healthy, constipation and diarrhea, you can get rid of that, and just increase your strength and independence, and just overall feel happier and fight off depression, which all of these affect our quality of life, and it's something that everybody can benefit from, for sure. So some of the things that CDC said what should be done to lead a healthy lifestyle. So eating fruits and vegetables, right? What about eating fatty and sugary foods? No, shouldn't do that. We should drink more
Water.
right?
Smoothies.
Or smoothies, good to get your fruits and vegetables, not Cokes and Mountain Dews, right?
Right.
Right? Good. And so what about watching television? You should do less of that. Yeah, and be more physically active. And then also promote policy and programming changes so that those healthy choices can be more prevalent for everybody, right? So we need to ask for those healthy choices.
Play games.
And you can play games. We're going to talk about those later. Okay. So the images I pulled for you from CDC, I really want to pull out the one in the middle. So what does it look like is sitting on that plate there for dinner? It might be easier for you guys out there to tell us, since it's hard for us up here to see. So the plate up top, what does it look like sitting on there? It is fried chicken, some mac and cheese, and baked beans. Sounds pretty yummy, right? And on that plate there at the bottom, where it's obviously got way too much food, right? What's on that one? Tomatoes, broccoli, grilled chicken or baked chicken, and sweet potato, right? So out of those, which one of those do you think has the most calories? The first one, right? That's absolutely right. The top one has 607 calories, and the bottom one has 293. So look how much more food you're getting to stay full longer, and how you're getting those really nice red tomatoes and green broccoli, right? So healthier stuff for you, and you're not even eating as many calories. Right. So just by educating, even on that one little picture, it's really eye-opening to think, oh, I can make that change, right? I can do that differently. I can be better at that. Good. And what is another benefit of health promotion, in addition to all those health factors we talked about, is the economic benefits. So you're looking at lower health insurance costs, fewer visits to the emergency room or doctor, and then if you do have to go, you're going to stay there less, right, because you're healthier, and just your increased productivity from day to day. So that's something as employees and as employers that's really important, that we want to be able to put that money back in our pocket. Maybe having the increased productivity means less sick days and more vacation time, right? So that's a good thing, in addition to just feeling healthier. So I've been talking about health promotion. I realize some of you might not exactly know what that is. According to the World Health Organization, health promotion is defined as the process of enabling people to increase control over and to improve their health. It moves beyond a focus on individual behavior towards a wide range of social and environmental interventions. So health promotion utilizes education, political, environmental, regulatory, and organizational mechanisms. So it's kind of all-encompassing when it comes to it. A lot of people confuse health promotion with health education, when really health education is just a very vital component of overall promotion. It differs in the sense that that's an actual planned opportunity for learning experiences that's based on theories and focused on intervention and motivation and educating on certain skills. So a lot of the lessons that we're going to talk about later, that was specifically education, but we use those to promote the healthy lifestyles that we wanted to make every day in our lives. So the first video that we've got pulled up for you today, this is actually one that this group of friends of mine have not seen. My colleague Carrie Jones and I produced this. She did most of the work. So I'm really excited for them to get to see it. It's our world debut of just kind of showcasing the highlights of what we did this fall.
Health Matters program is an evidence-based exercise and nutrition health education curriculum for individuals with developmental disabilities, authored by a team of professionals at the University of Illinois at Chicago. I'm never gonna give it up. No. For 12 weeks, we met for 2 hours, 3 times a week, working on empowering participants to take charge of their health by learning what it means to be healthy and what healthy looks like and feels like to them, so that they could in turn make healthier choices and therefore live happier, healthier lifestyles. This is gonna be the best day of
my life. I feel so much better about myself.
And exercise is really important.
Eat things that are healthy for you and stay healthy every day, and all that.
You can tell your friends or family about it so that they support you and stuff.
Lessons consisted of 30 to 60 minutes of educational classroom-like setting, followed by 45 to 60 minutes of physical activity where we incorporated the subject of the lesson into the exercises or with an active game.
Learned warming up.
My favorite thing about the class was learning how to do healthier things for your body. Eating the right things and learning how to do more exercises.
Having good friends and just to have fun. Eat the good stuff.
Yes, I can do this.
I anticipated the program to go well and be successful, but my expectations were entirely exceeded. What was most impressive was how much each participant accomplished. Collectively as a group, we lost 27.2 pounds over those 3 months, and there were visible changes in the participants. They started drinking more water, being more active outside of class, and incorporating healthy food choices into their diets.
1, 2, 3,
Bye. Take care.
So as you can see, we had a lot of fun doing our health program, and that's what we're going to talk more about with you guys today, and we're really excited to share with it. And it's just really incredible to be able to see that footage, to because I know us talking about it doesn't necessarily do it justice. So hopefully that video kind of gives you a good idea as to what we were able to accomplish. And Carrie did a lovely job of putting that together for us. So to tell you a little bit more about the Health Matters program, it is an evidence-based curriculum for adults with IDD. There are 36 interactive modules as well as 23 additional lifelong learning modules that are included in this curriculum book. So it's everything that staff and employees would need to be able to run a successful health promotion program. There's lesson plans in there, as well as each of us had our own workbook so that we could fill out certain games and worksheets and write our own goals in and certain things. We had our own private notebook with that, which was really nice. And so the curriculum itself really gave us a great structure to work from, to be able to know what kind of education that we needed and what kind of activities would be good. And so we had a lot of fun making it our own as well. So straight from the Health Matters programming website, part of their mission statement I wanted to share with you because I thought it was just really all-encompassing. And it says that people with IDD have a right to receive education and services that promote their health. The Health Matters program incorporates the concepts of choice, self-determination, self-efficacy, self-advocacy, rights, and responsibility. For maximum involvement of people with IDD in making physical activity and nutrition goals, having the power of support staff and community support and the provision of health promotive rather than curative activities can improve health outcomes. So what I really like about this part of their mission statement is that they're focusing on that it is a choice, that everybody has the ability to make those healthy choices and just need the education and empowerment to be able to do so and to do it on the front end. So all the information I gave you guys earlier about the rates of obesity and heart disease and how sad that is, that we can make an impact on that at the beginning by doing the preventative aspect of teaching how to be healthy, what it means to be healthy, and going from there versus doing it on the back end of trying to combat all the secondary conditions of all the unhealthy things that we had discussed. So when it comes to the Health Matters program, it is based on Bandura's social cognitive theory as well as the 5 theories or stages of change in the trans-theoretical model. So I wanted to share that with you all today. For the social cognitive theory, there's a high importance of reinforcement that's included with that. So these are responses to behaviors that increase the chances of reoccurrence. So you're going to focus a lot on setting goals, understanding the tasks required to achieve those goals, and having self-efficacy to be successful. Self-efficacy is a big component. And then the success in changing these health behaviors are going to focus on the individual believing that their current behavior poses a threat to their health or to their goals, what's important to them, and that health promoting these behaviors will reduce this threat, and that we as individuals possess the ability and the responsibility for adapting that behavior change into our lifestyles. So when it comes to reinforcement, the social cognitive theory has three ways to address that. The first one being direct. So that's with the instructor providing verbal feedback. So let's say I tell Monica that she's doing a good job. She's out there working hard, and I'm telling her she's doing great, right?
Yeah.
And so that's direct. Vicarious would be when you are, unlike observational learning, you see that being happen, and you say, I want to hear that. And Brandy's like, I want to hear Lindsay tell me how good of a job I'm doing. So she starts kicking it up a notch, right? And so that way she'll be able to get reinforced that way. And then the third way is the self-reinforcement. So that's you yourself giving yourself rewards and goals for your behavior and not needing any external or outside forces to do that. Behavioral capacity, that's for individuals to perform specific behaviors. They first must know how to do them, so how to exercise, what is good nutrition, things like that, so that they can have that knowledge necessary to build the skills to be able to master that, to be successful. So that if you have the knowledge, you're going to then feel like you have the capacity to engage in that behavior. Some more constructs from social cognitive theory include the expectations. So that is your ability to think and expect outcomes. An example would be enrolling in a weight loss program. You would expect to lose weight. That would be your expectation of that behavior. Expectancies is different than expectations, so not to be confused with those. That's more where you will choose to perform an activity to maximize the positive outcome or maybe decrease the negative outcome. So how important is it to be healthy, to eat better, to be physically fit? Those values that you place on that, that's what that's focusing on. And then for self-control and regulation, that's where when you're working on your behavior and you monitor it, you want to see what you've been doing, you'll adjust it to make yourself more successful. That's what self-control and regulation is referring to. And then the big Mac Daddy is self-efficacy. That's our internal competence to be able to perform the task or behavior. So with self-efficacy, it can be situation specific. So, an example of that would be if you would be really, really motivated to eat healthy or drink more water, and you feel good about that because you can control what you put on your plate. But then I ask you to go to an aerobics class with me, and you're like, I don't like to dance. I'm not so confident in my dancing abilities, right? So you don't have that self-efficacy to necessarily do the aerobics class, right? Something that Bandura said, a quote from him is that unless people believe they can produce the desired results and forestall detrimental ones by their actions, they have little incentive to act or preserve in the face of difficulties. So to be able to be successful in healthy behavior change, you have to have that self-efficacy, that confidence, because there are going to be challenges when you're faced with choices, right? Just a couple more constructs to finish it up. Emotional coping responses talks about how to be successful in learning, we need to be able to adapt to anxiety that's going to be associated with a certain behavior. So that's looking at being able to know how to navigate when we do come face to face with those kinds of situations where we have anxiety about a healthy behavior. For example, exercise can be associated with fear. Right? You might be fearful that you're going to do it incorrectly and suffer an injury, or that you might fall. So if you have that fear and that anxiety with exercise, you've got to find an appropriate coping response to be able to navigate. Well, I'm just going to start slow. I'm going to do a little bit at a time. I'm going to make sure to have a friend with me so that they can watch me or catch me if I start to fall. Those kinds of things that you set yourself up for success with. Those are what would be your coping responses. And then reciprocal determinism, that's where Bandura is talking about that the individual, the behavior, and the environment are all bidirectional. They all influence each other. So here's a great image that shows that, how the arrows go both ways, that we can affect our behavior, obviously with our choices, but that the environment has an influence on that, and that we, in turn, can affect our environment. So a good example of this would be, let's say we're all here and we're not happy with the vending machine options. They're all unhealthy, because in my fantasy world, we would all want to have some healthy options in the vending machines, right? So because of that, we aren't happy with our environment. We go to our manager and say we'd like to have some healthy options to be put in the vending machines, right? And so because of that, then the vending machine company is going to get more money, because we're going to actually be purchasing those items. So the person, the environment, and the behavior all interconnects to have influence on each other.
Yeah.
Excellent. So then last is the locus of control. And that's just focusing on, do I have the control over the reinforcement and what my behavior is, or is there some kind of external forces? So like we talked about, maybe the environmental or social factors that affected the maps to look that way. So being cognizant of what your role is in that, as well as what the external role is for that as well. So in addition to the social cognitive theory, there's also the trans-theoretical model, which focuses on the processes of change and how to maintain those changes over time. So this model integrates several major theories within the approach, and that's where you're going to have, at each stage, you're going to be more increasingly working towards the next stage, become more motivated and ready to change from stage to stage. Because behavior change, it doesn't happen quickly, doesn't happen overnight. You don't decide one day, I'm going to quit smoking, and wake up the next morning as a non-smoker, right? That doesn't happen like that. So you've got to understand that there's a process of change, and that you have to be appropriate at each level, because we can't just go from 0 to 60, so to speak, when it comes to healthy behavior changes. So the image that you see on the slide is actually from the Health Matters curriculum book, and I thought it was a really nice representation of of how you work through those changes and through each process at each stage, and that the chance of relapse is always present, right, no matter where you're at along the way. So for the first one, that's our pre-contemplation stage. So the mindset of the individual is that they're either unaware of the health issue or they're in complete denial about it. Maybe they're blaming some kind of external outside factor. It's not their fault, right? And they're not interested in making any kind of changes. So from a health promotion standpoint, they're not going to be as open or as excited to hear about what you have to say, right, when you want to talk about healthy lifestyle changes. So at this level, we're really just looking to increase understanding of the health issue, to promote knowledge and talk about physical activity, nutrition at a general level. So a good example would be, just giving information on drinking more water, which everyone knows it's good to drink water, but maybe by saying specifically, did you know that it can increase your energy, can boost your complexion, or help you have a healthy weight, or maybe even aid in your digestion and prevent constipation? And if that individual, is concerned or place a lot of high value on any of those aspects, then maybe their wheels will start turning, the seed will be planted, and they'll think, oh, I hadn't really thought about that before, which leads us to the contemplation stage. This is where they are aware of the issue, they're going to consider changing, but they're not fully committed to it, and they're kind of weighing the pros and cons, so to speak, in their mind, trying to figure out, is it worth it? Do I value this enough to actually change my behavior? So from the health promotion approach, you can aid in that by helping to highlight all those positives, and then also to highlight the negatives to help them in weighing those options. A great example of this is that even though most smokers know that it's unhealthy, they are fully aware, but they don't care, don't have any desire to change, right? That's what they want to do. And so they might be in the contemplation stage to say, one day I'll quit smoking, but not today. And that's where, as health promotion professionals, we just want to give them more information, keep telling them why it's good for them to consider that healthy behavior change. The next stage is the preparation stage. So that's when they said, I'm going to do it. I'm going to be healthy, I'm going to make this behavior change, and I'm going to start working towards that. So an example of this would be maybe actually starting to buy exercise clothing or equipment to actually have that, or maybe dropping as many cigarettes that you smoke throughout the day. You are starting to drop those down, but you haven't given it up completely, but you're taking steps towards actually giving that up and making that healthy behavior change. So from the health promotion approach, we want to help them set goals to identify what barriers or influences might be present that can help them change that behavior. So that way, as we keep moving along, we kind of know what to expect for when times get hard. The action stage is when we're actually starting to do this behavior change. It's at the very beginning. We're setting an action plan, asking our friends for support, monitoring our progress, and maybe giving ourselves rewards for doing these healthy behaviors. So an example of this would be, if you're going to say that you're going to do physical activity, then you need to set a goal. So maybe that goal is 3 days a week. Well, what days of the week? What time of day? What certain exercises are you going to do? The more specific you can get in your goals, the more you're going to set yourself up for success. So in the health promotion standpoint of being supportive in that, you want to help to reinforce the behavior change. So maintaining those goals, what are they? What can we do to make sure you remember them, and help to keep you accountable for that? And then ways to navigate the barriers. So identifying what those are and trying to set up those coping strategies so that you can be successful with that. Once we've been in the action stage for a while, hopefully we'll get to the maintenance stage, and that's going to be where the changes are sustainable over time, where maybe it's more of a habit, right, than just something that you've really been working on. You've developed those coping skills, and they're pretty well set in place, so you know how you're going to respond when those situations arise. But you're still going to continue to seek support and monitor your progress, because as we know, it's not easy, right? It's not easy to make those healthy changes. So we want to just keep continuing to work hard at that. So for health promotion, we would help to review the information, focus on confidence building. This is where self-efficacy really comes in play, because let's say you've been doing so good, you've been eating healthy all week long, and then Saturday comes along and you are going to have a cheat day, and it turns into a cheat extravaganza, right? That can really rock your self-efficacy. And you don't want to do that. It's okay, it happens. We just get right back on there. So in the maintenance stage, it's important to just remember just to keep trucking, to keep moving along. So when relapse does happen and we get off track, that's why, the excellent example that we use with the trans-theoretical model, showing that it's a circle, that it's constantly moving, and that relapse is right there in the middle. A big thing that can help you get off track is a vacation or holiday. Tamara can agree with that. She went on a little vacation in the middle of our program and came back, was really disappointed in the things that she did on vacation. And as a group, we said, you know what, it's okay. We're just going to jump right back into it, and we helped get her back on board. So that's something to remember, that it's not the end of the world. It happens. And hopefully over time, as you continue to work on those coping strategies, you'll just continue to be more successful. For example, my husband decided to give up soft drinks in February. And he continues to this day to still really want them. That's my next slide talks about temptation. For me, I gave them up over a decade ago, and so to this day I don't really have any cravings or wishes to drink soft drinks anymore. So it's just kind of continuing to work on it, which is really important to remember that it's a step-by-step process. You want to reach your goal through each stages of change. You can't just go from the end straight to the action and maintenance stage. So when it comes to health promotion strategies, you want to make sure that you're giving the proper education and support at each stage to promote change to that next level. So that way you're setting up for success. You're building a good foundation to get to the next level, just like a pyramid, so that when you get to the top where the winds are blowing and it's a little bit harder to stand, you've got a really good foundation. So when it comes to self-efficacy in the trans-theoretical model, there's confidence and then there's temptation. So confidence is that feeling of ability to engage in your healthy behaviors when you're faced with certain challenges. So that's knowing that I'm going to say no thank you when I'm offered a cigarette, or when someone asks, do I want fries or a side salad? Making the right choice with that, having that confidence that I know what I'm going to say. But the temptation is always present. It is situational. So thinking about a good example is the holiday potluck. We had one earlier this week at work, and there's an entire table of desserts. Do you really need one of each to taste all of them, or do you just want them? What is the temptation that's present there, right? And it's hard. And the most common types of those situations, negative effect is your internal feeling or emotion where you set standards and you didn't quite meet it, and that feeling of where, maybe I shouldn't have had all 5 of those desserts, right? Just one would have been enough, right? That kind of feeling. Emotional distress, where if we've had a bad day and you go home and find yourself eating an entire carton of ice cream. It happens, right? Yeah, to the best of us. Right? That was a temptation. Or the cravings, like I mentioned earlier, with my husband needing his Coke. He's done good though, hasn't had one since February, but he'll come home one day and just say, I just want one. I just want it. So just being able to recognize that those situations are going to occur and be accepting of those, and know that it's absolutely acceptable, but it doesn't derail your entire train, because as long as you've set up those coping strategies, it can be effective, that you can really continue to make those healthy changes. My grandmother is 97 years old. She still lives alone. She would drive if we let her. She talks about it all the time. She renewed her driver's license at 90, but we took it away. The thing that she'll tell you is the secret to life is moderation, that moderation is key, that you don't want to deny yourself the things that make you happy, but too much of a good thing can be bad. So especially in working with this group up here, we did talk a lot about what our temptations were, what our barriers were, and trying to discuss in those situations ways that we could navigate that. So in trying to inspire you to incorporate more health promotion strategies in what you do, I think that's a really big component of, you can maybe understand the theory, understand of how to work through the stages and what it means to educate and to empower. And a part of that is talking about the hard parts and what is going to be negative, so that you can know how to handle those situations when they arise. So at this point, we can take a little bit break, but while we're all here, and that was that was the big chunk of the, I don't want to say boring, but that was the more educational component of what we had to talk about. Does anybody have any specific questions about the social cognitive theory, health promotion with trans-theoretical model, or anything like that? What about you guys? Feel pretty good?
Yeah.
Yeah?
Yeah, they're done great.
No? Thanks, Brandy. I appreciate that. That was the hard part. The next part's the fun part, right?
Oh boy.
Oh, boy. Good.
I talk weird.
No,
Yes, I do.
everybody can understand you just fine, isn't that right?
Not that good.
And they're excited that you're here. So that's what matters. So we're going to take... That's right.
You are good. Okay.
Social
Dee.
supports. It's a really big aspect in what we're doing. So we're going to take just a little 5-minute break so that everybody can stretch their legs. 2? What?
Yeah,
We'll do 5. We'll gotta go to the bathroom. There's only a couple stalls in there. So stretch your legs, get a drink of water, and we'll be back in just a couple of minutes. Okay, we're gonna get started to talk about the fun stuff. Just a polite reminder: if you are at a remote site, if you could please mute your mics, just for the next little bit of time being, that would be wonderful because we can hear some of your all's conversations. You guys ready?
I'm ready.
Yeah. Good. Okay, welcome back. So, we're going to talk about what we did with the Health Matters program. So, as you saw in the video, we did do the 12 weeks of the exercise, nutrition, health education curriculum. We met 3 days a week for 2 hours. We, for each of those days, did a 30 to 60 minute lesson plan from the book, followed by 45 to 60 minutes of a fitness activity, always doing a warm-up, the activity itself, and then a cool-down. And then we also always like to play a game that incorporated what we learned, usually. And then, as is tradition for me, we always ended with a team chant where participants would select the word for the day based on what we learned. And then we'd do a big cheer. And then, in addition to our athletic attire, part of our required uniform was to always wear a smile to be encouraging of ourselves and each other. And I think we did that, accomplished that pretty well. I'd say so. So before getting started with incorporating any kind of physical activity into what you're doing, you definitely want to make sure that everybody is safe to participate in physical activity. Okay? So an easy way to do that is with the PARQ form. The link that I put into the slides is just from Ace Fitness, but you can Google that document. It's a copyrighted document that you can use as long as you don't change it. You can get it from all different kinds of websites, and it's just real simple. Ask some basic questions, and if you get an answer yes to any of those, then I would promote the individual to a doctor and get approval to be able to engage in physical activity. But if you answer no to all of those, then it's reasonably safe to assume, that you would be okay for physical activity. So and that's called the PARQ, the Physical Activity Readiness Questionnaire is what that stands for. I have seen some people take those and kind of modify it to make it their own, but just using the regular form is an easy way to do that. And then in addition to that, every day that we would get together, we would ask questions to make sure that we were feeling good for physical activity on that day. So what were kind of things that I asked you guys?
Did you take your meds?
Did you take your meds? Did you eat breakfast? Brandy always give me a no on that one. How you were feeling that day, right? Were you experiencing any kind of pain or anything that we needed to know about? Usually I was feeling tired. I got that a lot because we met Monday, Wednesday, Fridays at 9. But that wasn't a good excuse, right? Being tired. No, that's right. Good. So when you're being physically active, it's good to know the level of intensity. So the Borg rating scale of perceived exertion is a universal tool that's used for that. The one on your slides is what we pulled directly from the Health Matters curriculum. We really like it because it has the light green going to yellow to red, so you've got your color variation of knowing where you need to be with your intensity. In addition to that, you've got the words going from light to hard to very hard. And then also the pictures of the lovely ladies that are exercising. Up top, she's walking, leisurely, got a big smile on her face. It kind of looks like she's power walking. not breathing too heavy. There in the middle, we've got someone who looks like they're running, but they're doing pretty good. They've got a nice stride. And what about the lady at the bottom?
Very hard.
She's running pretty hard. Her face has got a grimace on it. Her legs are as far apart as she can, running as fast as she can. Her hat's flying off. She doesn't look like she's having too much fun. No. Right? So we definitely liked to use this to show where we needed to be and the level of intensity. Obviously, as you're getting started, you want to be more so at the beginning. And then when you're actually working and doing your physical activity, where do we want to be, guys?
In the middle.
Right in the middle. That's good. So, and some people might think it looks interesting that this number chart starts at 6, but that actually correlates to your heart rate if you multiply it by 10. So just as we're sitting here in this room, not exerting any physical activity, our heart rates are somewhere in the 60s. So that's what's at the very top of the chart. And so if you multiply that by 10, when you're working at your 12, that's actually about 120 beats per minute for your heart rate. So that's why you're looking at the 12 to 15 is your ideal range for your target heart rate. Good. So when it comes to physical activity recommendations, it's important to know that it does not have to be vigorous activity, right, guys? It can be moderate activity, which a good definition of moderate is being able to walk 2 miles in roughly 30 minutes. So that pace would be what puts you in the middle of that work chart. So that it's like walking, dancing, gardening or yard work. Swimming would be good.
Or exercises.
Any kind of exercise or the house chores. I know Monica told me sometimes doing laundry feels like exercise. Where
Or
she's
folding the clothes.
folding the clothes.
Or feeding the dogs.
Right. All those are good examples of physical activity.
Definitely no Mountain Dew.
Right.
That was one of Tamara's goals. So
Oh, bear.
that's true. That's also true. So when we're talking about physical activity, that's different from fitness, right? Physical activity can be a lot of different things. So that was one of the things that we talked about, right? That you can do lots of different things. That doesn't just mean going to the gym. And our recommendations, you guys remember what the recommendations are?
More water.
Well, with the physical activity that we're talking about, how much should you exercise?
A lot. 30 minutes.
Right. So 30
30
minutes.
minutes
How
or
much?
to 20 minutes.
Right. So 20 minutes of vigorous activity, good, or 30 minutes of moderate.
Or
How many days a week?
3 times or 2 times a day.
Right?
I
Okay.
don't
2 times a day
know.
would be good. So the actual guidelines that you can get from the CDC, the American Heart Association, any of those places, the government organizations are going to tell you 30 minutes a day on 5 or more days of the week for your moderate activity, which is pretty much every day. You want to try to get 30 minutes of activity. And then strength training, we want to try and get 2 or more days of the week, because just to get normal, healthy lifestyles is 30 minutes a day, most days of the week. So if you want to be physically fit, or you want to lose weight, or you want to do something that's really going to increase your health even more than just baseline, that's where you need to add more activity, or you do the strength training exercises to really boost that. Okay?
like you're playing a sport.
Yeah, right. Like if you're
Like
an
flag
athletic.
football.
Right. So you want to be working
Or
out.
thing.
Good. So what did we do for exercise components, guys? What did we do?
Flexibility.
That block right there.
We did use that block. So we did our FABs,
No.
right?
They
Yeah, we're going to talk about that one in a little.
ball.
So the FABs, can you tell everybody what FABs stands for?
Flexibility.
Aerobics.
Jake, what's the B stand for?
Balance.
Yeah?
Balance.
And strength.
Strength. Good. So for the Health Matters curriculum, that was how we broke out our exercises in this fabulous, fantastic way. So we used all of these components and incorporated that into what we were doing for our activities. And it was a fun and easy way to be able to make sure that we got all of those components so that we could be fabulous. So for the first one, for flexibility, guys, what does that refer to with our muscles?
Balance.
For flexibility.
Oh.
Stretching.
Strength. Or
Stretching. Right?
Strength.
Good. So I know you're nervous. You're doing fine. Flexibility. You can look on my screen with me too. That's when we're stretching. So that's how easasily you can move joints and muscles. You
Hold and stretch for at
Wanna-
least 15 minutes.
can say it louder.
Oh.
15 seconds.
hold the strength for at least 15 seconds.
Good. So you want to hold your stretches for at least 15 seconds so that you can get a good stretch from that. You don't want to be in pain, right? We don't want to have any pain while we're stretching, just mild discomfort in the muscle that we're stretching. And what about bouncing? We don't bounce in our stretches. We want to hold it static so that we don't want to have an injury from bouncing too hard while we're stretching. It's also important to do stretches when? Warming up, right? And then how about at the end?
We cool down.
When you cool down.
Yep.
Perfect. So you want to incorporate flexibility at the beginning and end of all your activities. Great. So A stands for aerobics. And what muscle is that working?
Your heart.
Your heart.
Good.
Yep.
So that's your cardiovascular endurance. So that's going to improve your cholesterol, your blood pressure, help you lose weight, decrease body fat, and just your ability to be more active, right? And ironically enough, if you feel really tired, doing aerobic activity does what? Does it give you energy?
Yeah, sort of.
Sort of. That's true. So when you're doing aerobic activity, the intensity should be identified either using your heart rate. We use heart rate monitors sometimes. Do you remember how we checked our heart rates? Can you show everybody where we did that?
Like right
Here.
here.
Or here.
Right? Good. So you can check your
Or
heart
on
rate.
the ankles like I had to do.
Or you could also do your ankles. That's right. Or even on your chest. Sometimes we did that
Yeah.
too. So that way we could see how hard our heart was working. The ideal time for aerobic activity is 20 to 30 minutes, but in at least 10-minute intervals. And I know Miss Sue really liked this fact that you don't have to do that all at one time. So you could break your 10 minutes up, let's say 10 minutes in the morning, 10 minutes at lunch, and 10 minutes in the afternoon. That's still your 30 minutes a day, right? So that way, if maybe one of your excuses is also that you don't have enough time, you could break it up so you still get your 30. And then what about the 1 minute rule? Right.
Do it for 1 minute.
And after you do it for 1 minute, what's going to happen next? You're going to be more likely to keep going?
Yeah.
Yeah? I think anytime nobody wanted to do something, if we did it for 1 minute, everybody kept going. Nobody sat back down, right?
Right.
Right. So that's a good rule to have. All right. And B stands for
Balance.
Good. So we work balance to work our leg muscles and our core. And why is that important?
Because like
So they don't fall.
So you
or
don't
get
fall.
injured.
Right. Excellent. So especially as we continue to age, balance is really important to continue to incorporate that into your physical activity because we want to continue to stay independent, right?
Yep.
So we did some good balance exercises, and when we started with those, we would be holding on to something, right? You guys remember? And then what was the next step?
Letting go.
Letting go. And then the hardest step, which we only did a couple of times, was actually closing your eyes. That was the toughest level of intensity for balance. We didn't quite get there in 12 weeks. That was pretty intense, right? Yeah. Another way to increase your intensity is by holding your arms close to your chest versus, when you're keeping your balance, right? We were using our arms to
Or,
stable.
or to the side.
To the sides, right? Keep them to your sides. Or hold a weight in your hand that could add some intensity to your balance. But we did a lot of good balance exercises, and one that we're about to show with you today is anytime, anywhere exercises from the Health Matters curriculum book. So for this, I like to start at the bottom with the number 3 because ironically that's the easier one versus the top one. So while everybody's here in the room or wherever you are elsewhere, Randy, you be careful. Ideally, you would want to not have any arms on your chair, right? But we're just going to stand a couple of times, work on our balance.
Whoa.
Yeah. We're going to do it? Is everybody ready?
Yep.
So we're all going to stand up. Shouldn't be so hard, right? But you want to make sure, where are our shoulders? Right over your hips, right? So when you sit down, you're going to stand back up. Good, and you're going to sit down. And you're going to stand back up. And back down. Back up. How's everybody feeling? What's happening to your heart rate?
It's beating.
Is it good?
Yep.
Is it coming up a little bit? Anybody that thought they were falling asleep, were you awake now? Good. So this time when you stay standing, if you try to stand on one foot, you can feel the little muscles, right, in your standing leg working to hold your balance. You might feel ridiculous in doing these things, but
I think she was talking about the
that they weren't doing it.
not us.
But the thing about it is that something as simple as standing up a few times, everybody's laughing, right? We're kind of in a better mood. Maybe some endorphins were released, hopefully. And hopefully those of you that are joining us at remote sites were joining us in those activities. But it's nice just to kind of get your blood flowing and work a little bit on your muscles, because just hearing us talk about it's not the same as actually doing it, right?
Yeah.
Right? So this was something that we could easily do to share with you no matter where you were. Yeah? So in working on balance exercises, that's an easy thing to do. I know there's been times where my colleagues and I have been at work, been really tired. It's 2 o'clock. You kind of hit that lull. We'll do a couple sit to stands. Maybe see how many we can do in 30 minutes, really? 30 seconds or a minute, but just kind of get the blood flowing and moving can get the same thing going in your brain to help you to think better. That's a lot of what we did. We always made sure that we tried to constantly be moving so that we could really retain our information. And I think that these guys are proof that was working. Yeah? So everybody feels pretty good? We're in the balance?
Show them that walk.
We are. That's in a little bit. Good.
Come on.
Sit down.
Oh, my name.
Good. So those are some simple things you can do
Good job.
anywhere, anytime, right? Standing, so going from sit to stands, balancing on one foot. I like to do that sometimes when I'm brushing my teeth. You're already standing there anyways, right? Yeah, or standing in line at the grocery store. Those are perfect times to actually start working your body just a little bit, and that's going to count towards your overall activity for the day. And then the top one is walking heel to toe. So putting your heel in front of your other toe. That one's a little bit harder, right? Kind of walking the line.
I told them.
Yes.
Terry,
About what?
told them.
You want to show? Well, it's hard for everybody to see. That's why I was using my hands. But that's where you put your heel in front of your toe, right?
You know,
Yeah, I'm glad you're
Dale.
excited though. Good. So those are all things that you guys can do easily any time of day, right? Good. So hopefully that helped wake you up after our break. All right, so we did our FAB. Larry, what's S? Strength. Good. Right, so strength training is going to increase our muscle, right, endurance, to make us stronger. It's going to help increase our independence, right, because we're stronger. It's going to, ironically, again, boost your energy and decrease your fatigue. And a nice thing is when you build muscle mass, it increases your metabolism. So for those of us who are, maybe worried about losing some weight, incorporating strength training exercises can actually help you burn more calories at rest while you're just sitting there at your 60 beats per minute, hanging out in your chair, working on your computer. If you've got stronger muscles, you're going to be burning more calories, which is great. So some important things about strength, right, guys? We don't want to do the same muscle group 2 days in a row, because that'll make us sore. And what about that last rep that we do? So we've done 10. We want to make it more challenging.
Don't hold
You're
it.
going to hold it. So we like to hold it for that last one for 10 seconds. That was a good way.
10 or 15.
Brandy always liked to up the numbers a little bit. She likes to challenge everybody. And another big thing that's important about strength, because I think this is probably one of the aspects where a lot of people maybe have that fear or anxiety, is making sure you want to do something correctly, is that you don't want to do it fast. Slow and controlled motions are what is key when it comes to adding some strength exercises, because you want to make sure that you've got proper form and that you're being safe about it, and you want to work the muscle longer, right? Because the longer that you're working, the better the benefit's going to be.
You want to do it both sides.
Absolutely right. Did everybody hear Tamara? She said you want to do it on both sides so that you're even. Good. Okay. So those are our FABs. So the video that I've got for you now just shows, as a group, we went through the FABs and kind of explained them and led in a couple of exercises for each of them. So we wanted to share that with you today so you guys could see that, since it's kind of hard. We did what we could in the room, but so that you could see what it looks like on a bigger scale.
F is for flexibility.
And what does flexibility do for our muscles?
Stretch our muscles.
Excellent. Okay. Brandy, why don't you lead us in some flexibility exercises?
Okay.
Okay.
What am I going to do? Oh, yeah.
So what are we doing with our arm?
I forgot.
We're reaching our arm across, right? And where should your shoulder be?
Downward.
Good. Very good.
Then straight.
Switch.
Remember, keep your shoulder downward.
Good.
Good job, Randy.
Good. All right, what's next? Is it our teacup stretch?
Yeah.
Which way we want to go?
This way.
Okay.
Always not too far down.
Mm-hmm.
Just in the middle.
Just in the middle. That's why we keep our teacup handle, right?
Yeah.
To make us not go too far.
Yeah.
Good.
Now to get straight. Not too far. Now.
Gonna reach for your toes?
Yeah.
Okay.
What she said.
All right.
Not too far.
Not too far. Good. Knees slightly bent. That's right, Miss Sue. And what do we remember when we come up?
Slowly.
Slowly. Good. And then what?
Smile.
Finish with the smile. Good job, Miss Brandy. That's our thing.
Blah, blah.
Aerobics is good for your heart. And we're going to do sit and stands for 10 times.
10 times, right. So for your sit to stands, you want to make sure to sit in a chair that doesn't have any arms so that you're not tempted to use them, right? You want to keep your hands on your knees, but you don't want to use your knees. You want to use your muscles in your body to stand up. So have your feet about shoulder distance apart with your heels on the ground. You're going to scoot up. Yeah. Good. You're going to scoot up just a little bit. Sit up really tall. And when you go to stand up, I'll show everybody one time, okay? When you go to stand up, make sure you keep your shoulders over your hips so you use your body to stand versus doing the lean forward. We don't want to do that, right? We want to sit up tall. Make sure you're breathing because these will get you going, right? Okay, Miss Monica, count us in.
Now,
Yeah.
1,
Say ready, go.
ready, go.
Up.
1,
Good. Stand all the way up. 2. Nice. 3.
4, 5,
6. 7. 8. Whew. Keep breathing.
9,
10. Whew. Good. And what was that for? What letter?
aerobics.
Aerobics. Good job.
B is for balance.
And what does that do for us?
Helps us balance our bodies.
Keep us from
Falling.
falling. Right. Okay. So what are we going to do?
We're going to do some calf rising.
Excellent. So for your calf raises, you're going to be on the back side of your chair.
Back side of your chair,
Feet a little bit shoulder
feet
distance apart.
shoulder length apart.
Okay. And you can hold on to your chair with
You
just
can either
your
hold on
fingertips.
to your chair or let go of it. And
Good.
lift up to your toes and lift up on your toes.
As high as you can,
Your toes,
right?
high as you can.
All right.
And hold the 10th one.
Okay. All right. Count us in, Larry.
1,
Whew. 2,
2,
3.
3, 4, 5, 6, 7, 8, 9,
And uh-oh.
10.
Hold it up. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Woo! Shake it out. Shake it out. That was
S in our word of FABS is for strength, and it builds strong muscles.
Excellent. And there's lots of different things that we can use at home to help us build those strong muscles. Masu has her normal dumbbell weights. You can get in different sizes so that you can grip those and hold on to those to use them as resistance in your hands. Now Miss Monica, she's got a resistance band that has handles. So she's standing with her feet shoulder distance apart, with her feet standing on the resistance band and holding those handles, so that way she can use the resistance bands to build her muscles, right? And then we've got Larry. He has our fantastic arm wrist cuffs, so he doesn't have to hold on to anything. It makes it nice for that, and they just Velcro on there, so when he moves his arm, that gives him what he needs to get his resistance. Brandy over here also has a resistance band. Now the thing about resistance bands is the farther apart you stand, the harder the resistance is. So see, when she stepped her feet apart, the resistance band stretched, right? So that's going to make it a little bit harder as she moves her arms. Good, Brandy. Okay, and then if you don't have resistance bands or dumbbells, or you don't have any arm cuffs, you can make your own weights at home with bottles. This one's just full of water, and it's still heavy, and I can use that. This one is filled with rocks, and I believe we put rice in there, right, guys? Mm-hmm. Yeah, all kinds of things. Beans, right. Anything you want to put in your bottle. Soup cans, right? Mm-hmm. Things like that, so that you can use to work your muscles and build your strength. All different kinds of ways. Whatever you've got at home, you can make it work. Good deal. So what are we doing today, Miss Sue?
Okay, first we're going to do bicep curls. You want to have whatever you have in your hand, whatever you're using, with your palms straight up, keeping your elbows. We have a firm base. You want to raise your arms up at the same time, or you can do it one at a time. We're going to do 10, so ready, guys?
Ready.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Woo! Next we're going to do, shake it out.
Shake it out.
Next we're going to do straight arm raises. That strengthens your muscles in your arms and shoulders. You're going to keep your wrists straight and your arms straight at all times. Ready, guys? 1,
palms down.
2,
palms facing the floor.
3, 4, 5, 6, 7, 8, 9, 10. Shake it out.
Woo!
Always know that you can stop and get a drink of water at any time. Water is very important. Next we're going to do shoulder press. You want to keep you can do it one arm at a time, keeping your elbow next to your ear at all times. Ready, guys?
Ready.
1, 2, 3, 4,
Keep your shoulder.
5,
Good.
6,
Keep that elbow to your
7,
ear.
8, 9, 10.
Good, Brandy.
All right. Shake it out. Always do equal sides amounts. Ready?
Ready?
1,
Don't let that
2,
wrist break.
3, 4,
Bring it down.
5, 6, 7, 8, 9, 10. You want to keep your back straight and working your stomach muscles as well.
We like to say bring your spine or your belly button all the way to your spine to keep it all flexed. Nice and flexed. Woo! My muscles are worked. These are heavy water bottles.
All right.
So that was definitely interesting. So when it comes to developing some type of fitness activity, you want to consider the FIT principle, which stands for frequency, which is the number of times that you're going to perform the activity, the intensity, so that's going to be the level of difficulty. So versus my really heavy bottles with rocks in it, versus the 2-pound dumbbells that Miss Sue had. And then the time, the length of the duration that you're going to do something, and then the type of exercise. Those are the things, if you're going to start to incorporate something into what you're doing, the FIT principle is what you want to consider when you're trying to develop that. And some important things to remember, right, are to start slow, especially if this is the beginning of a fitness or exercise program. You want to start slow so that you can be safe. Adding variety to the type of activity so you're not working the same muscles consistently. And then you can increase intensity by adding weight or more body movement. So especially for aerobics, if you're just moving your legs, once you add your arms into it, what happens then? Your arms get to going. I'm gonna have to make everybody do arm circles now to get you back awake. Does your heart rate go up? Right?
Yep.
Right. So that's another way just to increase the intensity. So what's something that we always need to remember to do before we exercise?
Warm up.
Warm up. That's right. And
Right.
stretch first. That's so important. We got to make sure that we do that because what does it do to your body?
And breathe.
And breathe. Right. It wakes it up. Gets your heart rate up slowly.
And no sleeping.
No sleeping.
Oh, I
No
go
sleep while you're
sleep now.
exercising. That's going to decrease your risk of injury. And it only takes 5 to 10 minutes to warm up, just to slowly start getting your body moving, right? Especially if you're maybe feeling like you were before we did our sit to stands, a little bit tired. You want to kind of wake everything up. And then what about at the end?
Cool down.
Right?
Cool
You
down.
want to cool down. So that's going to help prevent blood from pooling and collecting in those muscles that we worked. So hopefully help keep us from getting really sore. And then it's going to bring our heart rate
Or
down.
ache.
Or ache, right? So we're in that yellow area and we're in the middle. We just immediately stop. What might happen?
You get injured.
You get injured. You could get dizzy,
Or
right? So-
lightheaded.
lightheaded, right? So you want to slowly bring your heart rate down, and that's going to also decrease in the soreness that we talked about if you're stretching afterwards. And that only takes about 5 minutes, right, to do a cool down. So whatever activity you're doing, just start to slow it down for the last 5 minutes and bring
Well,
it
if
into
you
a good
like it, you could do it for 4.
or 4. That works too, as long as it's a good couple of minutes, right? So something else that we talk a lot about is drinking plenty of water. You all want to tell them what's important about drinking water? That you were telling me before we got started?
Oh, God.
Being nervous?
No.
Monica, you're telling me how much water you should drink.
15.
The 6 to 8,
Oh yeah, 68.
6 to 8, right? Ounces. 8-ounce glasses of water every day. And we should drink more water when we're exercising or sweating or when it's hot outside,
True.
right? Or if you're sick. And how often should we drink water when we're exercising?
As many as we should.
15 minutes.
Right, so every 15 minutes, if you need to remind yourself, or what Jake said, which was when you feel like it.
As many water as you can.
As much as you can when you need to. Good. Because actually being thirsty is already the first sign of dehydration. So if you're thirsty, you're already dehydrated, which isn't good.
Nope.
So some hints to help with that are to start your day with a glass of water or end it with a glass of water to make sure you're getting enough, or to carry a water bottle with you everywhere. So you've always got it handy. And should we be drinking something other than water throughout the day?
I do.
No.
I gave that up, Brandy.
That's right. There's teasing Tamara. Good.
I'm just kidding.
So for our nutrition education, we use the MyPlate, which is a great visual representation of what we should be eating, right, to stay healthy. So what did I say about the colors? Do you guys remember?
Red, green, purple, and orange, and
Right?
blue.
And that makes a what? Yeah, Tamara's saying
Of
it.
the rainbow.
Right. And so you want to eat the rainbow every time we eat, right?
Yep.
Wasn't that somebody's saying that Skittles, right? You don't want to eat Skittles, though.
No.
We want your plate to look like a rainbow because you're representing all the food groups, right?
Yep.
Right. So eating a lot of variety, focusing on fruits and vegetables, right? Remember when we tried some grains, some whole grains? Do y'all remember some good
How
examples?
about hummus?
Hummus was good, right?
Yes, I say
Vegetables was really good.
Good. Excellent.
So was it hummus?
Yep, we all liked those things. So,
I love hummies.
and you'd never had it before until class, right? Good. So, look,
It's
great
real
way,
good.
great way to incorporate a lot of nutrition education, right, into what you're doing by using the Choose My Plate. It's also important when we're doing health promotion to let others know, right? We want to tell our supports people what we're doing so they know what we're trying to accomplish and can help us with that, right? I know a really good example. Monica, remember when you were talking about not having the opportunity to go to the grocery store, right? And so we kept talking every week about just keep talking to your parents, tell them that you want to be able to make healthy choices. And then finally Monica came in one day and said she got to go to the grocery store and she picked out her own lunches. Do you remember what you told me you got?
Healthy choice.
All right, those Healthy Choice frozen meals, right? She picked those out all on her own. And what about the time you guys went to Burger King?
Oh, I had a smoothie and a salad. It was good.
Right? So the rest of her family got burgers and fries and a soft drink. And just because Monica had been educated and had the power and the knowledge to make those healthy choices when given the opportunity, she knocked it out of the park, right?
Yep.
It was good.
Well, me too, I will.
Well, good. I always want you to be healthy.
No,
Right?
not get out of the
Oh,
park.
that too. Right. So, yes.
After yesterday, I pulled all my Mountain Dews.
Good.
Now I don't want any.
Good. That's good for you. I'm awfully proud of you. So see, all it takes is the power of education and motivation, right?
Yep.
And one of the things that we used to do that was our weekly newsletters. So every Friday we passed out a newsletter that Carrie designed, and it had pictures of the participants making healthy choices so they could be reminded that they could do this, right? They could see themselves doing it and being successful. They saw all the things that we talked about, all those take-home lessons so that they could remember them, and then also ask for supports so they could see those discussion topics. And it really helped them advocate for their healthy choices outside of class, which is what's really important, is being able to have that opportunity to make those healthy choices.
I really wanted a cheeseburger,
But you didn't?
You see, I like to cook, and I usually cook turkey burgers.
That's good. Turkey burgers are
Turkey
good.
burgers with ground turkey. I make chili, spaghetti, some other things.
That's good. So cooking those things is healthier for you,
Yeah,
right? Than
yeah.
going out. Good.
But I still go out anyway.
That's right. So something else to consider about health promotion programming is that it can be low cost. I know a lot of people think that maybe you have to have an expensive equipment or you have to have a gym membership, things like that, but it really doesn't have to be that expensive. So in running this program, that was something that we all took very seriously, is try to think what were ways that we could be effective without spending a lot of money. And so to do that, we had to be creative, right? We had to do a lot of research to try to come up with different resources and ideas. And definitely want to say, do not underestimate the value of the dollar store, because they've got some good stuff there, right? So some of the things that we wanted to tell you what we did, one was ribbon dancing. We made our own ribbon dancers solely because I saw that picture on clip art. So what we did was we used, do you guys remember what we used? Can you show that? Chopsticks, right, that I swiped from the cafeteria for free.
And ribbon.
Yeah, and then ribbon that I got in the clearance bin at Michael's. So that was 50 cents to $1, and then pretty duct tape from the dollar store. And we made our own ribbon dancers.
Yep.
And then we used it for aerobics. So we had to make big motions, get high, get low, make big circles, small circles. And even Brandy, who hates to dance, that's why I included that picture there in the middle, because she
Yeah,
had a
I
big smile.
do hate dancing.
She had a really good time, right?
I
And got her
really
heart
do
rate up.
hate it.
That was good. So ribbon dancing, really inexpensive way though to do that.
And you can make them and you can sell them at yourselves too. That's what I'm gonna do.
You could sell them. Didn't even think of that. There's another way to do income.
You could
Get all kinds of ideas.
2 or 4.
So for the handmade weights that you saw in the video, where we made those, that was really inexpensive because not only that, we're recycling, so we're being eco-friendly, right? So we put in there, what was it, rice was in some?
And rocks.
Rocks we did, that was the one I had in the video that was heavy. We used beans. You could even use soup cans or anything with the handle. Easy way for it to be an inexpensive strength training tool for you. What about when we did the obstacle courses?
Oh boy.
That was a big highlight. That was a great way to keep it fun, right? So we have got some pictures up there of different things that we did, and it was a great way for us to practice motivating each other, right? And also motivating ourselves because we could time the time that it took for us to get through the obstacle and then try to beat our own time the next time. So that way we could show that we were improving and then giving yourself a reward for making your time better. So just to kind of give you an example of some of the things that we did the noodle hurdles. Do you guys remember that? I just taped some noodles to the floor and you had to go over those. What about getting the pedometer to 60? What did you have to do for that?
John plays like this.
Yeah.
Good.
I just broke my foot, so it's hard for me to do.
Right, but she worked through it, right? That was good. And then we did different things like bicep curls. We used the resistance bands, right? The sit to stands that we did, we did them together. Kind of get your heart rate up a little bit, right? So if you're trying to do those, a whole bunch of those in a minute, that's a surprising way to be working your bodies, right? We also did wall push-ups. Do you remember we did those?
I like doing
And the
those.
calf raises.
That's
Good.
easy on them.
And then the neat thing about the obstacle course is the first time we did it as a relay. So we had to high five the next person so that it went to the next person. Do you remember Jake had to high five Monica? Do you remember what the problem was we had with that? With your big muscles. Jake was so excited he was hitting Monica's hand so hard. And
I'm very delicate.
right. So the obstacle course, we got a little excited. And then the competition, instead of competing against each other, we competed against our own times. So trying to improve upon what we had done versus making it, a competitive against the group. Okay. Mental games. So these were activities that we incorporated the lessons that we learned while also incorporating some type of physical component. So that was something that we worked really hard to do. The first one was our baseball wellness game.
Yep.
That one was Jake's favorite, right?
Yeah.
So we had all the first, second, third base and home plate and the pitching mound and one dice that you could roll and hopefully some space to be able to have this activity. But as you can see from the pictures, we were in a small classroom and we still made it work and we still got to be physically active and challenge our brains by answering questions. So do you guys remember, how did you get to roll the dice?
We just rolled the dice, see what number it landed on.
And how did you get me to pitch you the dice? Did you have to answer a question?
Like health questions.
Right, you had to answer a health question. And then each number on the die correlated to what base that we could run to, right? So first and then second.
And then third.
Don't forget about
What was
that.
number 4, right? I'm not, it's coming up. What was number 4?
Home plate.
A home run, right?
Yep.
Good, and then the 5 and 6 were strike and
Ball.
so you had to roll again. So that was a really fun game, we really enjoyed that. And I would like to think it would be even more fun if we had a little bit more space, right?
Yeah.
True.
Yeah. So let's see, some of the other games, we played Jeopardy, and
Yeah.
instead of a, what's it called, the daily double, instead of that, it was a fab surprise. So you had to do activities,
Yep.
right?
Yep.
Yeah, and then we played the game where tossed the balloon around and the floor was lava. And it's surprising how much your heart rate will get up with that game. Good. And then what about this, Monica? You want to tell them about the soccer ball we've got?
Like we have to ask a question if you land it and what question you want to answer.
Right. Okay. And what about if it landed on a black square? Do you remember that, Jake?
Oh,
You get to do an activity, like a physical activity,
yeah.
right?
Physical activity.
Right. So, right. So this is all we did. I took a soccer ball and I wrote on it with some questions. So, do you maybe want to toss that to somebody and see if they can answer the question?
Do
Yeah.
I test them?
Yeah, you can toss it to Jake if you want to. Let's see. What did it land on? This guy. What's that one say?
What kind of grain is best?
That's a good one. So we're gonna eat grains.
Whole wheat.
Whole wheat, right?
Yeah.
Whole grains. Good. Okay. So, whoops. Whoa. Right? Does anybody that's in our group want to toss the ball? Do you want to toss the ball? You want to toss it out there?
And I,
Yeah. Sure. Oh.
sorry,
So
sorry about that.
that was good.
How long do you hold a stretch?
Oh, so how long do we hold a stretch for?
About 15 minutes.
Minutes or seconds?
50
Good
seconds.
time. Good. Good. You want to toss it one more time? It's a softball. It's okay. Give us a good one.
Well,
What's your favorite thing about yourself?
Oh, that's a hard one. What's a
Life.
life? Living life.
Life.
That is very
That's a
hard.
good one.
Yeah, my favorite thing was getting to be in the class with you guys.
That's good.
Thank you.
That's a good answer. So good. So we really enjoyed those kinds of games, right? Another one we didn't get to play because of space was playing volleyball with a beach ball, but sitting in a chair. So only using your arms and your legs to kick it up, and that's a
Yeah,
lot of fun.
that's fun.
That is fun. And then the one that they've been asking me to tell you about a couple of times as we've been up here is our Fabs dice. So we have a video showing you how we did the Fabs dice.
So as a part of our healthy nutrition and exercise program, we always like to play a game every day. And the one that we wanted to share with you is our fabulous Fabs dice. So this Fab dice we made ourselves, just writing on Sharpie on a wooden block that we got at Michael's. So let's tell you about what's on the block. So the first one we have is right here, F. What is it for? Say.
Flexibility.
Flexibility. And what does flexibility do for our muscles? Stretch. Stretch. Good. Thanks, Jay. And then I've got the letter A. Can you tell the people at home what the letter A stands for?
Aerobics.
And what does aerobics do? What muscle does it work?
Your heart.
Yeah? Good. So you got to get your blood pumping. That's aerobics. Good. Okay, let's see what we got next.
Balance.
B is for balance. Good. What are some balance exercises?
Like one on one foot, so you won't get injured.
Good. Reduce your risk of falling?
Yeah.
Yeah, excellent. Okay. What about this one, Miss Brandy? Strength. And what is it good about working on strength? Muscles. Building strong muscles. Nice. Okay. And then what's this one, Larry?
This pad is where you can do whatever you want to do.
Nice. Very good. Okay, I got one more. And what's this, Miss Tamara?
That means my plate.
Okay. And my plate, if you land on that, what does that mean?
You get to choose something you like, healthy.
Nutrition questions. Perfect. Okay, we've got a big, nice foam dice that I found somewhere in the office, but you can use any kind of dice that's got numbers on it, right? And each number is going to represent how many reps you do of what lands on the dice, right? All right, you guys ready to play? I'm sorry, are you ready to play? Yeah. All right. I'm going to let Jay roll this die first. Tamara's got her number. Let's see what we get. Roll it. Roll the die. Woo! Okay. And what we got here? Number 4 and F. So we've got to do 4 of something that works our flexibility. So what do you guys want to do? Anybody? Jay, what's your favorite stretch? Jay, what's your favorite stretch? Is it teacup stretch? Good. Okay, so everybody find some room. We're going to do 4 teacup stretches. So put your handle on and pour, reach. There's 1. Are you going too fast? Good, you gotta hold it slow, right? 2. Oh, goodness, that's a good stretch.
Feels good.
Good. And this is 3. Woo, 1 more. 4, that was a good one. All right. So now I'm going to let you, sir, get to roll this. And Sue gets to roll this. All right, let's see what we got. Oh, another F. You can roll it. I'm gonna vote for a redo since we just did F. Let's give us something else.
Yay.
All right, here we go. Oh, a my plate. So we got the number 6 and a my plate. So can you all name 6 healthy snacks? What do you got? What is it? Apples, good. What else can you eat that's healthy? Carrots, good. Fruit?
Tay chips?
No. Whoa.
Celery.
Celery, good. Okay, celery's good. I think we're full. We got 2 more. Jay, do you have a healthy snack?
Healthy snack.
Is it what is it? Is it healthy? A healthy snack?
Healthy snack. Healthy snack.
Is what? Is it avocado?
Avocado.
Ooh, avocado. That's a good one. And hummus. Yes, ma'am. Good job, guys. All right, let's see what we got next. Whew. Trying to keep my back. Okay, give us a good roll. Ooh, strength. 1. I vote when we land on 1, that means 10 seconds. 10 seconds of something to work strength. What do you guys think? What's a good one for people at home to do? Okay, so we don't have any weights, but that's okay. We can still do our bicep curls. If we do it really slow and we think about that muscle that we're flexing, pretend like we've got something really heavy in our arms, right? So let's do 10 together. Ready? Pull it up. Ooh, 1, down. 2, my arms are shaking. I'm flexing my muscles so hard. Good. And 4, whew, 5, 6. Good. Y'all counting? 7, 8, 9, 10. Whew, shake it out. Shake it out. Okay, we've got 1 more roll to finish our game. Miss Monica, you want to roll this? Yeah? Okay, I'm going to let Jay roll a die. Ready? Throw them down. Yeah. What do we got? A free spot. Okay. All right, Miss Monica, what do you want to do? Oh, we're going to do bottom kicks. Okay. Good. This works a little bit of our what? The legs. Good. Is it working your balance some?
Yes, I'll get injured or fall down and stuff.
Good. If we do it fast, could it maybe also work another letter? Maybe get our heart rate up if we go a little bit faster, right? You want to try that? So let's go a little bit faster. Ready? Whew. Can you go faster? Good. Can you move your arms too? And that's going to get it up more. Good. I'm going to move over here. Come on, Jay. Let me see you. Good. Good. Woo. All right. We landed on a number 5. I didn't even think about that. Should have counted, shouldn't we? Whew, let's calm it down a little bit.
Oh, yeah.
Good. Was that a good game? Good. You guys can do this at home anytime you want, and it's a great way to switch it up, so it can be a lot of fun.
You can do it with family or friends if you want to.
Excellent. Yeah, get your friends and family involved so they can be healthy too. Woo! Good job, everybody.
So that's our Fabs dice. That
Yep.
was very popular. And ironically, the first time we played it, do you remember what letter it kept landing on?
The A.
Almost every time it kept landing on it. We didn't plan on it being an aerobics day, but that was a big heart rate getting up day, wasn't it? So that was a really easy way to incorporate the exercises into a game, and it was a lot of fun. So let's see what else we got. We also did a grocery store and gym facility tour to get us out in the community, right? So we could learn about that, what our options were there. And the nice thing about that is I just made a phone call and it was free of charge and just set up the tour. And it was great to actually get out there to do that. Do you guys remember? Yeah. That was a lot of fun. And what about the picture? I included this picture for you all to be able to tell the audience what the lady in the far right, what is she holding in her hands? Tamara, you're the closest. You might be able to see it. On the over there when we were at the grocery store. She's got a can of Coke and then something else in the other side. That's right. Brandy knows.
I don't know.
You want to tell everybody?
Sugar.
So that almost entire canister that is full, that's how much sugar is in that one can of Coke.
That's right.
And so I think, and as you can tell as we've been talking, that's something that really hit home for our group, is being able to see how much sugar they were consuming, right? Is that's not good for us, is it? No.
Can caudal arteries.
That's right. It's not good for your heart. Too much sugar is not good for your heart.
Yeah.
So as I've been talking about the theory, we talked about being able to identify the barriers and the challenges to be able to navigate those obstacles. This picture is of the board from our very last lesson before we created our videos. And these barriers are actually what these fabulous fellow health ambassadors that are sitting with me, this is what they came up with as to what were their biggest barriers for being healthy and engaging in healthy behaviors. So you guys remember some of the stuff that you said about unsupportive people, right?
Feelings and feel tired.
Feel tired's a big one. What about that last one? I was really impressed when you guys came up with that one.
Yourself.
Yourself is your biggest barrier, right? Yep. So being able to identify what those were, the next column is where we talked about what are ways we can change that, right? What are ways we can overcome that? So you guys remember some of the things that we said?
Friends and family.
Friends and family, right? So social supports is really key. What is it?
No chips and dip. That's
Chips
about
and dip.
fattening.
Right?
Stuff.
Chips and dip is hard to do. The 1 minute rule was really big, right? Making a schedule and a game plan. And one big one, the bottom one down there, where it says I can't. Do y'all remember that one? What does I can't stand for?
I can't.
You can.
I can nail this.
You can always nail this, right?
Yeah, true.
So that's what I can't stand for anytime anybody tries to say that. So a big way to be successful is making it fun, because being healthy is a choice. So you want to be able to actually want to make that choice, right? The 1 minute rule was really big for us, making sure we had set tangible goals and then having a reward system set in place to motivate us, right? And keeping a schedule. Do y'all remember this schedule? I keep saying do y'all remember because I haven't seen them in a month. So I made this schedule for them. So what did you guys put in this schedule to help you?
What type of exercise?
Right. So you
Or
put,
how many minutes?
right? What day of the week? What exercise you're going to do? When you were going to do it? Maybe a nutrition goal. I remember seeing Jay's said he was going to only eat 1 cookie a day for one of his goals. Right? That was a good goal. Yeah, so a good way to help keep you accountable if you've got something to write down, a good schedule or log. And then how do we motivate ourselves?
Support.
Support system. What about putting the name in the bag? Do you guys remember that?
Oh, yeah,
Yeah.
I remember that one.
Kate, you want to tell them how we did that so that they can maybe do it on their own?
Yeah.
Motivation.
Motivation? Good. So to get your name in the bag, and in the bag at the very last day I pulled out 3 prizes. So the more times that you did certain things, you could get your name in the bag, right? So what were the things that you guys decided earned your right to put a name in a bag?
Supporting your friends.
Supporting your friends, that was one of them. What was another one? Let me give you a hint.
Drinking
Yeah.
water.
Oh, drinking water.
Drinking water on your own was good.
Yep.
And I got 2 more. What else did you do to get your name in the bag? There was a picture of a battery. And I was always giving Brandy a hard time. 7 it up. Bringing your A-game energy. That was a good way. A-game energy, right?
Yep.
And then the last one was improving on your record. So every time that we wrote down what we did, whatever our goal was, the next time we did that exercise, we try to up it, right?
That's right, yeah.
Yeah. So, and then that was a great way to get rewards. And then another great way to motivate is by giving them control. You know, I could stand up there and talk and lead all the exercises the entire time, but that's not going to be as much fun, right? So by allowing you guys to lead the exercises and say what you wanted to do and have certain things that you led, it made you more confident, right? And being able to do those, especially when I'm not there. So what did you all tell me about hearing my voice in your head after class when I wasn't around.
You can do it.
Right? Yeah. So even when I wasn't
Right.
there, you had that capacity to be able to make those healthy choices, which is good. So over the course of our 3 months, everybody gained really impressive, valuable health changes, and that was just in 12 weeks. So as you saw in the video, we lost a total of 27.2 pounds. The greatest of that being 14 pounds by one of our individuals, which is a little over a pound a week, which is incredible. In addition to that, there was decreases in our blood pressure, in the waist and the hip ratio, and the inches that were lost was really impressive. And then for our gentlemen who weren't necessarily looking to lose weight but maybe gain some muscle, they had some gains in that area as well with a couple of pounds, which is fantastic. And then one of my favorite things to highlight is Mr. Larry over here. When he came the very first day, he had a walker. I named her Sally, as in Mustang Sally, and that he had that and he used it pretty good. But by the end of those 12 weeks, he didn't even need her at all. We did our aerobic capacity by doing laps, and he's just lapping people, just moving and grooving, running along. You wouldn't even known that he'd ever had a walker. And so to even see him today without having her as in Mustang Sally the walker, not having her at all, that's pretty incredible. Is it a good feeling? Yeah? That's
Yep.
good. Y'all are being quiet today.
Yeah.
So we did it. We did 12 weeks, and I would like to think that you guys could see just how fantastic of a group that we had, and they did a fantastic job of really incorporating the things that they learn into their everyday lifestyles. So in closing, we hope that you can walk away with the importance of health issues and why it's so important to include healthy lifestyle choices into what you guys do. That it's lifestyle factors, it's environment, it's education. Those are the key components, and those are things that we have control over, because being healthy is a choice, right? And we should want to make that choice. So hopefully we've taught you some things that you can take with you and implement back in your respective fields, and hopefully this is also a call to action for you to want to lead a healthier lifestyle for yourself, and also to inspire others and those that you serve to be healthy. And then lastly, I am not a word pro wizard, but I am doing my best to learn, and we are developing a website that is wellnessforky.org, where we're going to have all kinds of resources, lesson plans that are supplemental to the Health Matters curriculum, all the videos that you saw today. There's even more that we're working to add on, and we're hoping to make more, right, in the future. And any kind of things and resources that would be beneficial to you guys being able to utilize this type of promotion programming into what you do to make it accessible for you. So it is definitely out there. And so now that we've got roughly 10 minutes left, this is your time for questions to be able to talk to, like I said, my fellow health ambassadors and I. If there's anything in particular that you'd like to learn more about, we are here to answer your questions. Or if there's anything in particular that you guys want that I didn't cover, that you want to make sure that you say.
Okay, and what, I can ask already.
Yes.
What was your all's favorite exercise that you got to do?
The block.
Go on the block?
And push-ups.
Oh,
Yeah.
push-ups. Awesome.
Yeah.
Mine was the sit to stand.
The calf raises, you like those? Jake, did you have a favorite?
What?
A favorite exercise?
Oh,
All of it.
Walking around.
this.
Oh yeah, you liked the teacup stretches. Yep, and Jay likes to go walking and running. We went walking outside. I think
Yep.
that was a big highlight, getting to walk around on campus. That was good. Good. Are there any other questions?
As being staff at one of the homes in the adult day training program, I think this is very beneficial to us as staff and for the individuals, because it builds self-esteem. At least it did for me, and taking them back to the office, they would talk to their fellow peers, and it helped them build their self-esteem as well.
They really enjoyed doing it, so I think it'd be beneficial to continue with it.
And I think that's good to reiterate that everybody benefits from health promotion. So, we had Miss Sue, she joined in as a staff member and had the full participation. She had her own workbook. She did everything that everybody else did, and she took it just as seriously. And I'm going to brag on her. She's the one that lost the most weight. So, I mean, you really, honestly, everybody can benefit from it, which is fantastic. And the fact that we did it together was...
And I lost 4 pounds.
You did, and I'm so proud of you.
They said at the office that by me doing it, it what's the word? Gave them the incentive to continue on with it. So I think if staff joins in, it helps.
To be here, I know you got to hear me talk, but I really think it's great to hear what they have to say. So, does anybody have anything else they want to talk about?
I love it here.
Now, my favorite one was whenever you go like this.
Be careful on the foot.
I had a hurt foot, so I blamed it on my sister.
I remember we used to talk about Johnny taking a bath.
That was it.
Shiny taste.
And Monica, were you going to say something?
I forgot what I was trying to say.
Oh, that's okay.
It's fine.
Okay.
Good.
You remember it one day.
Maybe.
Good. Well, we had a really good time being here to talk to you guys. I hope that you learned something that you can take back with you and continue to look for more resources on that website as we get them available. And if you don't mind, please make sure to fill out the yellow form, your evaluation form. That was the unmiked group that just left. We really enjoyed being here. We brought some of our curriculum and stuff if you guys are here and want to take a look, but my contact information was on the last slide. I'd love to hear from you if you've got questions you didn't think about today, or maybe ideas or ways that we can work together. But really, hopefully, the biggest thing you got out of today is being inspired about making healthy choices, because it's worth it.
Yep.
I hope you all come back.
Guys, high five.
High five.
I was waiting for a bee.